Okay. Okay, good morning, everyone. Welcome to the first Wheelchair Repair Task Force meeting. My name is Beverly Brakeman, and I have been appointed to chair this meeting. So I want to first thank everybody for being here. There's quite a few people on Zoom, so we're going to do introductions today. And I'm getting a little bit used to all this people on Zoom and people in the room. So let's start with a welcome from, I think the chairs are not on this task force officially, but wanted to say a few remarks, and the ranking members. So I'd like to start with Senator Seminara and Representative Case are here in the room if you want to welcome people.
Good morning, everybody. And Lisa Seminara here, and I am very much looking forward to reconvening this committee and working cohesively together to come to a happy medium with everybody. Thanks so much.
Thank you and good morning. Ditto. I'm here and excited to hear what has gone on since the legislature has adjourned in June, and see where we are and see where we're moving forward. So thank you.
Okay. So Senator Lesser and Representative Gilchrist, do you want to just welcome folks as you worked on this legislation, and then we'll move from there?
Sure. Thank you so much, Beverly, and thank you to all of the members of this task force. This is one of the most hot areas in the legislature, the state capitol at the moment. And really the genesis of this really came from consumers, hearing directly from folks who rely on wheelchairs, that they had a number of issues that they were concerned about, and it's our hope that bringing together the industry, consumers, payers, we can sort out a lot of these issues and help improve the experience for consumers across Connecticut. I am not a subject matter expert, and neither is my co-chair, Representative Gilchrist, so we are taking a step back, and we are trusting that we've convened a group of all-star experts from across the state and beyond to put your minds together to figure out if we can build a consensus of how to move forward. We've chosen Bev as your chair, but we want to work with you and support this task force. This is an incredibly important area and an issue that we both care deeply about. But we're going to trust you to do your job and to do the best you can to move this issue forward. And with that, I'll turn it over to my co-chair, Representative Gilchrist.
Thank you so much, Senator Lesser. I won't talk too much because you said everything I was thinking. Just really looking forward to the work that's going to get done here. Appreciate you all taking the time to have these meetings and to have these important conversations. Learned a lot last session about this issue, and just really looking forward to seeing where we can go and where we can find agreement. And just want to thank Bev for taking on the chairmanship. Thank you so much, everyone.
Okay, so let's get started with the official. Does everybody have the agenda? Chandra has the extra one. So I wanted to tell you a little bit. First, I want to acknowledge the legislators. Senator Seminara and Representative Case worked really hard with the consumers and with the industry folks to make this happen. And I think everybody is really excited to see where we can go with this. So a little bit about myself, so people know who I am. I come to this work after about 3 decades at the United Auto Workers and the nonprofit sector, focusing on lots of different issues around healthcare, disability rights, voting rights, and more. I got involved in this effort. This is so weird because I can't, this is a weird thing. I got involved in this work because when I left the UAW in January, I saw that this initiative was moving forward. And I care about it because of my experience working on disability rights, but I also have a personal connection to this work as my partner is a full-time wheelchair user and a spinal cord injury person of 4 decades. So I have some very personal experience of watching what life is like in a wheelchair, the challenges that are presented on a daily basis, and then the experience of having to deal with timely repairs can be very challenging and frustrating. So I think we all have really common goals, a willingness to collaborate and communicate and honestly and openly, and that's how I want to be a chair, that we can really move things forward. I think there will definitely be disagreements and some challenges ahead of us, but as the chair, I'm going to approach this with the highest level of integrity, transparency, and a commitment to really affecting change for users of complex rehabilitative technology. I want to thank Chandra, who's been amazing as our assistant on this, and she'll be taking notes and keeping track of all the logistical stuff. And I would also like to thank everybody for your time. So with that, I think what would make a lot of sense for this meeting is to just go around for those who have been appointed to the task force to do introductions. So how should we do that? Just start with the room? Okay. So why don't I'll just go around with the speaker list. Do you want to start with David Morgana, who's on Zoom?
Hello, my name's David Morgana. Spinal cord injury since 1997, and I've been a disability advocate for a very long time. And I look forward to participating on this task force. Thank you.
Thanks, David. Next, I have Jonathan Sigworth.
Hello, everyone. Jonathan Sigworth, full-time wheelchair user since 2006 and a resident of Stratford, Connecticut. And I run the nonprofit More Than Walking, which advocates and helps share the stories for people with spinal cord injuries. And I'm also a member of the SIL, State Independent Living Council, along with David and others here. And I'm just really happy to be here and work through these challenging issues with you, because it really means a lot to wheelchair users throughout the state and elsewhere.
Thanks, Jonathan. Rick Famiglietti, I think, is not here. Correct? I don't see him. So
That's correct.
Yeah. Okay. Michelle Dupree is also on vacation and not here today. So next I have Joseph Short. Is Joe on the call?
I believe he was having trouble logging in.
Okay, so we'll come back to Joe. Seth Johnson.
Yes, good morning. My name is Seth Johnson. I work for Pride Mobility and Quantum Rehab. We're a manufacturer of both standard and complex rehab power wheelchairs, along with seating and positioning systems and other complex rehab accessories. I've been with the company for 19 years, been in the industry for just over 25. Look forward to participating in this task force and helping advance solutions to address the issues that we all readily recognize must be addressed. So, thank you.
Thanks. Next, I have Melissa Marshall.
Hi, I'm Melissa Marshall, and I live in West Hartford. I'm a lifelong disability rights activist. I've done lots of work in Connecticut around disability activism. Right now, I'm with the Partnership for Inclusive Disaster Strategies, where I'm focusing on more national issues, but committed to Connecticut as well. I have cerebral palsy. I've been a wheelchair user on and off since I was 13, and I've been using a scooter for mobility when I leave my house since about 2010, 2010. And I'm really glad to be here. Thank you.
Melissa, great. Next is Sheldon Taubman.
Good morning, everyone. I am not a wheelchair user, but I work at Disability Rights Connecticut, where we serve folks with all kinds of physical and mental disabilities. I'm the litigation director or litigation attorney there. And before that, for 30 years, I worked at New Haven Legal Assistance. Of relevance here, I had a lot of cases involving access to durable medical equipment under the Medicaid program. So, through that experience, I've helped a lot of clients and seen the challenges and what can be accomplished if you address them. Glad to be here today. Thank you.
Thanks, Sheldon. Next, I have Wayne Grau.
Good morning, everybody. My name is Wayne Grau. I'm the Executive Director of NCART. Just like to take this opportunity to thank everybody. Also to all of the legislators, thank you for putting this together, and we look forward to working to get the resolution to this issue. So again, thank you very much.
Thanks, Wayne. Diane Russo, or I'm not sure I'm saying that right, Diane.
Don't worry, that's fine. It's Russo. Thank you so much. Diane Russo with NSM, National Senior Mobility. I am the Vice President of Payer Relations. I represent and work with all the insurance plans, also working with the operations team. I cover about a third of the country for the company, but very heavily focused in the New England markets. And I'm here to represent both sides of the insurance and the manufacturer and provider side of the business. Thank you for the opportunity.
Great, thank you. Next, I have John Lee Getz.
Hey, thank you for the opportunity to come. I'm John Getz. I represent Permobile, which is also a complex rehab manufacturer. We do power wheelchairs, seating systems, and other accessories. I've worked in the industry since about 2015. And then personally, my father is a CRT power wheelchair user for about the last 15 years. So I'm also his primary caregiver. So this issue is important to me, and I look forward to working with everybody.
Great. Gary Gilberti is next.
Good morning. Thank you so much for allowing me to be a part of this process. My name is Gary Gilberti. I am the Executive Vice President for New Motion. I operate the Eastern United States and have facilities in Connecticut. I've been in the industry for 38 years at all levels. I was an ATP for many years, owned and operated my own business for many years. So I'm really up to speed on the process, and I look forward to us finding solutions that work for everybody here. We at New Motion provide across the entire country, and we look forward to trying to improve things for our consumers so that access is there for the services and products we provide. Thank you.
Thanks, Gary. Susan Halpin is the representative from insurance, not able to make it, but we have Hillary Felton-Reed here on her behalf. Do you want to?
Yeah, sure. Hillary Felton-Reed with Robinson & Cole, and I'm sitting in for Susan Halpin today, who serves as the Executive Director for the Connecticut Association of Health Plans, which is the 5 commercial health insurance carriers in the state: Aetna, Anthem now, Elevance, United, Cigna, and Connecticut.
Great.
Thank you.
Okay, thanks. Next, we have Daryl Ruopp. Hopefully I'm saying that right.
Yeah, that's good. Thank you very much for allowing me to be on this repair task force. I am a wheelchair user for over 20 years, a spinal cord injury, and went to school as an occupational therapist, and currently an assistive technology professional in a school system. I do work, on my own chairs as well as help others fitted for chairs, and look to help out for the community any way I can.
Great. Thanks, Daryl. Okay, so from the Commissioner of Aging and Disability Services, Amy Porter, we have Jonathan Slifka.
Thank you, Madam Chair. Jonathan Slifka, representing the Department of Aging and Disability Services, and also a lifelong wheelchair user. So thank you. Happy to be here.
Great. And Commissioner of Consumer Protection, Brian Caffarelli, has designated Julianne Avalon.
Yes, good morning. Julianne Avalon. I'm the Legal Director at the Department of Consumer Protection. Thank you for having us.
Great. Okay, the Commissioner of Social Services, Andrea Barton Reeves, has appointed Ginny Mahoney.
Good morning. I'm Ginny Mahoney. I work with the Department of Social Services and Medical Policy. And one of my primary areas is durable medical equipment. And I thank you for allowing me to be a part of this committee where we can work together with our members, our Husky members, our DME and Medicaid enrolled providers, and everyone else to try to improve the access to the repairs to these wheelchairs that are, very essential for our members. Thank you.
Great. Okay, and the Commissioner of Public Health, Manisha Juthani, has appointed Barbara Cass.
Good morning, Madam Chair. Thank you. And again, thank you for this opportunity to represent the Department of Public Health. My name is Barbara Katz. I am the Senior Advisor to the Commissioner on Long-Term Care. And again, thank you very much.
Great, thanks. And Insurance Commissioner Andrew Mays has appointed Jim Carson. Is Jim here? I don't see Jim. Okay. Okay, next I have Representative Gilchrist has appointed Representative Frank Smith.
Thank you very much. I'm Representative Frank Smith from Milford. I am been appointed to the task force by virtue of introducing a wheelchair repair bill in the last session, which coincided with another introduction of a separate submittal by my colleague, Representative D'Amico. I was very unaware of some of the challenges facing power wheelchair users prior to being notified of this issue by a friend and constituent who I'm sure is tuning in today. I was very impressed also by the level of interest and a commitment to reforming some of the practices in this particular industry by both the industry side, the supplier side, as well as the users and advocacy groups. Everyone seems to be dedicated to the idea that this is something that does need some change, in both in terms of the industry and in terms of the advocacy and the wheelchair users. I think it's a very promising proposition, and I am very grateful to our chairman Gilchrist for appointing me and for all of her help in seeing this through to the establishment of this task force. And I welcome the proceedings coming, and I'm very pleased to be here. Thank you.
Great. And I see Joe Short actually is now. Do you want to introduce yourself, Joe?
Yes, good morning, and thank you for allowing me to be on this task force. I'm an advocate at Independence Northwest, which is one of the 5 state independent living centers, and I've been quadriplegic for over 20 years, so I'm very familiar with the challenges of getting repairs done to wheelchairs. So I just thank you for allowing me to be on this task force, and I look forward to some positive changes.
Okay. All right. Well, so it's a big group. So lots to do. So today's agenda, basically the introductions of, I'm going to do a PowerPoint, which is a brief review of sort of where we started and how we got to where we are now. And then, sort of most importantly, I think we want to talk about common goals, next steps, and a meeting schedule. So with that, Chandra, do you want to show the PowerPoint is short, don't worry. But I think it'll be helpful to those who haven't been involved with our informal meetings. So this is a sort of a timeline of the legislation. So you can, do I do that or do you do that? Okay. Okay. Do you have the? Okay. Okay. So, so the timeline basically for people who, so we started off in February with House Bill 6702, which was referred to the Human Services Committee. There was a hearing. The reason there was 2 public hearings, I understand, is there was a power outage. Is that right? Yeah. So on March 21st, the bill was voted out of the Human Services Committee and a joint favorable substitute change of reference to the Judiciary Committee. And on March 23rd and 24th, that happened. On April 25th, so that bill did not go any further. Between April 25th and May 22nd, we had some informal working group meetings. On June 5th, there was the bill was rewritten as an amendment called House Bill 6855, an act establishing the task force that was passed in both the Senate and the House, and became Special Act 2322, signed by the governor on June 28th. So that's a little bit of the legislative history of the bill. So the initial bill, House Bill 6702, you can read from the joint favorable report, was that wheelchair users have experienced a series of delay when it comes to repairing their devices in a timely manner. Not having their wheelchairs repaired in a timely manner has caused great stress amongst wheelchair users, as it compromises their independence, getting to work, or moving within their homes. This bill will require manufacturers of powered wheelchairs to provide documentation, tools, hardware, or software to allow a consumer to repair or hire an independent contractor to repair a powered wheelchair. So you can see the bill was much different when we started out, and along the way with conversations, it was decided that getting everybody in the room to discuss what made the most sense in terms of legislation and common goals was going to be a more effective process. So, but I just wanted people to have that history. You can go to the next page, yeah. So you can see, and I'm happy to share this with people, but that original legislation was much more substantive in terms of 3 days notice of repair, warranty and repair requirements, involved the Aging and Disability Services Commissioner to set up a working group, 24-hour call response. There was some language around violations, and it struck. There was also an original bill, I think, that Representative Smith did, which was called a right to repair bill, which would have allowed consumers to fix the chairs themselves, which some consumers can and some can't. So you can go to the next page, Chandra. So that was that bill. What we did at that time, and I really want to, really acknowledge everybody at the table, and particularly the legislators, for really making this happen. Senator Seminara and Representative Case have really been very hands-on. So we had informal meetings of many of the people around this table on these dates: April 25th, May 2nd, May 15th, May 16th, and May 22nd. And that was how we ended up with the task force bill. And I think probably a lot of where we will jump off from for this task force. So you can go to the next. So 6855 became law. It was an act establishing a task force to study minimum standards for timely repair of complex rehabilitation technology, which includes wheelchairs, scooters, and mobility devices. You can go to the next page. As I said, that's what it does. And but not limited to improving timelines for assessment and repair of such technology by a manufacturer or authorized service provider upon notification from a consumer about the need for repairs. Next page. And then these are all the different things that we were charged with. It's kind of small, but like I said, I can share this. But our task force, I think it is important to sort of acknowledge or that our job, what we are charged with, is examining and making recommendations for policy, regulations, and legislation necessary to improve the independence of motion and quality of life of consumers using CRT. Assess barriers of timely repair of CRT, including but not limited to recruitment and retention of staff, travel time to complete repairs, geographical locations, authorized providers, supply chain, and parts availability issues. Review how the repairs are paid for and by whom. Survey consumers statewide to determine the scope and breadth of the problems associated with timeliness and cost of these repairs. Study the successes and challenge experienced by other states that have policies, statutes, or regulations associated with this type of technology. Go to the next page. The task force members, you can see, I don't need to read through this, who the appointments were and who they were made by. So, and that has, I think everybody has made their appointments. So I think that's the last slide, right? One more. Oh, logistics. Chairperson, we are late. We were probably very ambitious in saying that we would have everybody appointed to this task force by July 15th and our first meeting by the end of July. So we're running a little bit behind. And I know part of what we're going to talk about today is our schedule going forward. And having reached out to everybody on the task force, I think there's general agreement that meeting more than monthly is going to be absolutely necessary in order to meet a February 1st deadline to have a report for the committees of jurisdiction. Chandra is obviously going to be our administrative person and the person for whom we can all communicate information to each other on. Although anybody, we can all talk to each other informally or whatever, but she will be our main point of contact. And that is basically an overview of how we got to where we are now. So does anybody have questions, concerns about that? Is that pretty self-explanatory? Okay. So now, so there was a lot of things that came up, that came to light, I think, in the informal meeting. So I think what I'd like to do now is spend a good chunk of our time talking about what are the goals we want to have, what are the common goals we want to accomplish. I mean, we know the end game is some sort of assurances that wheelchair users and CRT users can have their equipment fixed in a timely manner. But I wanted to sort of open the floor. I know during the informal meetings, there were a number of things that came up. So we can, if the legislators want to start, and we'll go from there. And I'm just going to stop talking.
So I think it's very important from the onset, at least from my perspective, to say that in the informal meetings, there was discussion made that we would be focusing on the Medicaid population only. And I think we need to go way beyond that. I think when I got involved in this project or in this task force, I'm not picking winners and losers. So I am not picking people who just have Medicaid coverage, because there are many, many wheelchair users who have private insurance, and they too have issues and problems. So I wanted to say from the onset that I think we should be looking at this issue as a consumer issue for everyone, not just Medicaid people. So I'm hoping as we continue to go forth that we are considering legislation or considering making changes for the population at large rather than a small segment of the population, or I shouldn't say small segment, but a segment of the population. That's all I have for now. Thank you.
Yeah, I just want to add to that, Senator Seminara, that, you know, as we're doing this conversation around goals, we may want to sort of write down the information we're going to need going forward. One of which is, I thought we had this, but I don't remember, was how when you look at the CRT population in Connecticut, is there any way to get a sense of how many are Medicaid, Medicare, private pay? So that might be a sort of information that we want to try and get.
Thank you, Madam Chair. And I think that the end game for everybody here is to make sure that everybody's heard and everybody's voice is out there, and that we are treating this throughout the state as a priority. But we want to make sure that we have all the facts on the table of what we can do and what we can't do, and try to help the struggles with the industry, but also the struggles with the consumers, because it's the consumers who are really having the difficulty. But there are things in this economy and things that have gone on that, you know, might be out of our control, but we want to try to bring all the parties together. And that was one of our reasons when the bill came forward, it was sort of mandating, but when we looked at it, it was just Medicaid. And we want to make sure that there's private insured people involved also, because this bill is to help everyone who is having quote unquote issues with chair repair or what have you. So we want to make sure we reach all populations, and we work together to get a common solution that works for everybody. And I get it. I know it, that when you don't have that mobility, you don't have that chair, your life really halts. So we want to make sure that that doesn't happen, and to our best of our ability, make legislation that actually works, and that we can get the different commissioners and everybody on board with what it is. Because if we don't have everybody on board, it makes things more difficult. And I think that's why this group is together. And, you know, having Beverly at the chair here, and, you know, she was at our first meeting working with us and seeing what was going on. But we do a lot more when we work together and get stuff done. So thank you.
Thank you, Representative Case. So let's just open up the floor to others who want to talk about questions, concerns, common goals, and ideas for next meetings. You know, this is our time to start to figure out how we're going to move forward. Do you want to help me if people raise their hands on the? Oh, Jonathan? Oh. Jonathan Sigworth. Yeah, go ahead, Jonathan.
Hey, thank you, everyone. I just want to especially thank, Representative Seminara and Case for being a part of these important discussions, and for your previous involvement as well. And most importantly, for your commitment to help us make sure that all payers, that all types of insurance, not just Medicaid, through proposals that we make and legislation that may come out of this, are subject to mandates that really help and emphasize the importance of the quality of life for all wheelchair users in Connecticut. And to be sure, in the previous bill, while consumer advocates were focusing on the most vulnerable of our wheelchair user population, those who are depending on Medicaid, I just want to reassure everyone that was only because at the end of the last legislative session, that was the only possible population that we could affect with legislation that could have been passed in the last session. So our eye was never off the ball on changing legislation for all consumers. But we are just so happy to have your support, Representative Seminara and Case, to have that affect all payers. And I just want to, move forward, if I may. Is this an appropriate time to review kind of the consumer priorities briefly? I guess that's a yes. So if I could share my screen.
Hold on a second, Jonathan, okay?
Yes. Okay,
Let me just talk to the legislators for a sec.
sure.
Yeah. So one of the things that I'm really committed to making this sort of everybody, that everybody is able to present information. So we definitely need to hear, what the sort of state of goals that for the consumers and also for the industry. So I guess I would sort of open it up to the committee. I think what we could do is, Jonathan, I think what you might be talking about is to just identify some of those things that the informal group came up with that were agreed upon. Is that what you were talking about, Jonathan?
No, I wanted to review all of the points that were up for discussion during the informal meeting, as well as cover those things that we did have time to discuss, but there were other points that we're not able to discuss, but that were part of the agenda that were never gotten to, that are the starting points for this task force.
Okay, so are the folks that are here from the industry, are you prepared to sort of put forward some of your goals as well? And then we could just start that process. That would, I guess, be Wayne and Gary and others.
Beverly, I think one of the things we'd like to talk about too, and Jonathan, good to see you. So I think one of the things we'd like to talk about is we have not been resting on this. We've been working on this. And I think both Gary Gilberti, who represents New Motion, and Diane would just like to share some of the things they've been working on to fix these issues. So if that's okay, and I've got no issue with Jonathan also, excuse me, talking about what the goals were for the consumers as well. So
yeah, and we're happy to hear from them.
Great. Then what I would do, Jonathan, why don't you go ahead and then Gary or Wayne or whoever from the industry can go ahead. And then what we would ask is that you share that information with Chandra so that the rest of the committee can have it together. Yeah. So go ahead, Jonathan, then.
Excellent. So yes, I've already shared this with Chandra, and I'm also sharing a public link in the chat so everyone can follow along. But I will share my screen. Here we go. So again, so many of these points, if not all of these points, were kind of consumer priorities that we had identified, our group had identified since the beginning of the year, and that we've wanted to talk about and address with the industry. We know that many of these are contentious, but we really feel that these represent some of the basic needs of wheelchair consumers in the state, if not the country, where we as wheelchair users we can't vote with our dollars when which repair service we go to. We're mandated to continue with the same company that our insurance initially used when supplying our wheelchair. So we're really kind of stuck in the system, and we're not paying for it out of pocket completely. So the policies really depend. We're at the mercy of these private equity owned companies, as well as these massive insurance companies, as well as Medicaid and Medicare policy. So we're really dependent on our legislators to hear our needs, as well as for the industries to hear our needs. And really, as our task force, our number one priority is to look at how we can improve the quality of life for people with people who use wheelchairs in Connecticut, as well as other forms of complex rehab technology. So just to briefly go over these 20 points. Our first priority is that CRT, or complex rehab technology, that is, just to define it briefly, any kind of durable medical equipment or mobility device that is customized for an individual, such as a custom wheelchair. So CRT equipment providers must offer in-home repair services for products they provide, not just repair services, but in-home repair services. Why is this vital? Because if your wheelchair is broken and you don't have easy access to transportation to drive to a repair service, how are you supposed to get there in an emergency? If your primary form of mobility is inoperative, you really need someone to go to your home. 2, CRT providers should provide 24/7 availability of a human being to intake a wheelchair repair request. Consumers do not always have control over the opportunities they have to make such requests, and after-hour requests are more likely to be emergencies. 3, CRT providers should provide after-hour repairs for emergencies, especially those that are life-threatening or have significant risk of health issues. 4, CRT providers should offer repairs during extended business hours that include weekends and holidays. 5, after an initial non-emergency repair request, CRT technicians must conduct a repair evaluation, either in person or via telehealth, at consumer discretion within 3 business days, unless consumers waive that requirement. We've surveyed wheelchair users in the state, and we found that people are waiting a week or more to get their initial repair request evaluated, whether it's in person or via telehealth. And that really needs to decrease significantly so that we can get the repairs we need on a timely basis. 6, once an evaluation is conducted, there must be CRT provider repair timeline requirements for various categories, ranging from same or next day repairs for the simplest or most urgent repairs to a maximum of 1 month for preventative maintenance requests. Timeline requirements would vary based on the urgency of the repair and the components involved, with flexibility allowing for complications with supply chains or authorization. We understand that the system is complicated, but there really is no reason why expedited or overnight delivery of parts can be a reality for wheelchair users when these parts mean the difference between I'm able to go to my class, or I'm able to go to my work, or I'm able to go grocery shopping because I have a flat tire. This should not be an issue, and we really need these timeline requirements to maintain that quality of life. 7, CRT providers must provide transparent and permanent consumer records for all service requests that include all steps of the request and delivery process, such as tracking numbers, delays, etc. We've heard multiple reports of consumers putting in a repair request, there being significant delays, them calling back and seeing that their initial repair request was deleted and a new one created in order to, whether intentional or accidental, in the records show that the timeliness was better than it actually was. So we really need transparent and permanent consumer records for that purpose of keeping these repairs accountable. 8, there must be penalties for CRT timeline violations and emergency protections for consumers facing health crises as a result of violations, in addition to any incentives offered for timely CRT repairs. We can envision these penalties or incentives coming from the state, coming from various payers, but these really need to be in place to make these timelines real. And that is the only way that wheelchair users can be assured that their chairs can be repaired in a timely way. Bed sores and pressure sores, ulcers, these things are extremely costly and dangerous and life-threatening, which is why we also need those emergency protections as well as timelines. 9, CRT providers must offer consumers the appropriate waivers to avoid delays due to federal prior authorization requirements. There are currently consumers who are on Medicare, and without national changes, you can't waive certain prior authorization things that cause delays in the repair process. However, there are waivers that they can sign. Those need to be offered to avoid those delays. 10, CRT providers and manufacturers must have in-stock, overnight, or expedited shipping contracts for all wheelchair parts, as almost any wheelchair component can be at the center of an urgent repair request that affects consumer safety and independence. I want to emphasize we are not saying that everyone has to have all parts in stock. This is or in stock, or overnight, or expedited shipping contracts. 11, insurance must cover overnight and expedited delivery for all wheelchair repairs. We understand that there currently aren't any codes for covering overnight or expedited delivery. I believe that's what we came out of our previous discussions, but we really believe that's necessary. 12, CRT providers must provide loaner wheelchairs according to robust safety guidelines to all requesting customers for whom it is safe and appropriate during a prolonged repair, despite the warranty status of the wheelchair being repaired. In short, if a wheelchair user in Connecticut needs their wheelchair repaired, they need to be provided a loaner wheelchair if that's a possibility for them, no matter what. We cannot have consumers forced to lay in their beds for weeks on end, developing life-threatening pressure sores because of a delay in a wheelchair repair. 13, CRT providers must prioritize all repair requests for consumers who are not suitable for loaner wheelchairs. This is self-explanatory, so that those wheelchair users are not subjected to the risk of being without a chair. 14, the Department of Aging and Disability Services or another department must have the authority to implement or promulgate regulations that come out of these discussions. Consumers will never be satisfied with recommendations that come out of this task force that do not have teeth. We will never be satisfied with that. 15, consumers must have access to documentation of regulation violations found by the regulating state department. 16, Connecticut, okay, so 16 through 20, these are the points that were discussed and that representatives of the CRT industry and consumers have agreed upon. 16, Connecticut must eliminate the requirement for prescription, statement of continued need, or prior authorization for all wheelchair repairs for all payer plans that operate in the state. 17, Connecticut must require all payer plans, where applicable, to reimburse for travel to any location outside of the provider's office, diagnosis time to assess the issue, and labor time to complete the repair, parts to be billed separately as they are presently reimbursed. 18, preventative maintenance must be a covered benefit by all payer plans operating in Connecticut for all items, not just wear and tear. The insurance company will publicize this benefit through their standard communication methods. Preventative maintenance can be performed by the providers twice per year at the request of the consumer. The provider can perform preventative maintenance services for the consumer when they are performing other repairs to the wheelchair. The provider shall be reimbursed for travel time, diagnosis time, repair, labor, and parts. Prior authorization will not be required for all repairs performed during a preventative maintenance check. 19, Connecticut must require insurance reimbursement to maintain any consumer's backup wheelchair so that they can be safely accommodated without loaner wheelchairs during a prolonged repair. No prior auth required, reimbursement just as all other repairs. And this is really important, number 19. To have a backup wheelchair and not have to cannibalize it for parts, as many wheelchair users currently do, will be such a game changer, especially for significant repairs where you otherwise might be provided a loaner wheelchair that doesn't allow you to be as independent as you are in the community. But instead, if you can maintain that backup wheelchair, especially if you're not suitable for a loaner, if you have a very complex power wheelchair that has custom drive controls, this can be a lifeline. And finally, 20, Connecticut must eliminate the need for a medical necessity form for Medicaid patients to travel to a covered complex rehab technology provider for wheelchair repairs. I mean, currently, even for patients to go to a service location, to an office for repairs, it is a time-consuming process, and there are significant barriers to be able to do that. And finally, to achieve efficient and timely repairs, among other priorities listed above, we know that CRT providers will need more and better trained staff, and we as consumer advocates are committed to supporting that effort any way we can. And those are all the points. And as I said before, these are really important to consumers. We will do our best to brainstorm solutions, but we're committed to these. Thank you.
Okay, thank you, Jonathan. We are actually, I guess Chandra did get a copy of that just a few minutes before the meeting. So she is going to share that with the rest of the task force members so that we'll have that.
And I just wanted to also mention, I think, as I believe our goals for this task force is to address each of these points, I would like to request that any of the parties that are affected in each of these points, if everyone could respond to the document that will be circulated by email before the next meeting, so that we have starting points for discussion on each of these points.
Oh, so I think this is our first meeting, so we're kind of working out all the kinks. I had actually thought we might do the sort of state of both industry and consumers at the next meeting. But this is good, actually, that we're getting it done now. What we're going to do, we'll pass that information around, and we're going to have the industry also now present some of their goals, and then we'll have sort of the two documents to look at. Okay. And yeah, who is it, Wayne or Gary, that was going to do that?
This is Gary. I think I'll start.
Okay.
Hey, Gary, before we start, so first of all, Jonathan, thank you for sharing those. I did notice that the priorities have expanded. I believe the last one that we originally dealt with 12, and now it's 20, and you changed some of them. So I appreciate it. We just haven't had a chance to look at them. So we really can't respond. One thing on there, I think the last one was not only the medical, I got to go back and check my notes. Okay. But the medical necessity, I think, is a big one, but we need to also make sure that will be funded where individuals, if they so choose to go to one of the locations to get repaired, it does need to be covered. Okay. So I'll check my notes. I'll be ready for that. But I believe that was one of the things that we had discussed, because I think Gary will share some light on some of the changes that they made that actually will speed up repairs. So I'll just be quiet at this point, and I'll turn it over to Gary for right now.
Thank you, Wayne. And Jonathan, I appreciate your presentation there and each and every of those points, and we would love to kind of digest those, and I know some of them are the same points as before, some are new ones, and we look forward to kind of working through them. Look, nobody wants us to improve more than we do at New Motion. We have no incentive to delay a repair for somebody in a wheelchair. There's no incentive for us. Now, it's costly to provide this service, especially with reimbursement the way it is. And I like some of the things that you suggested, where there's some reimbursement for the travel and things like that. And then, but mere economics of a lot of this is just very difficult. And I'm just going to try and share some things that we have done and some things we haven't invested in. You know, we already do have remote service capabilities where a consumer can call in and be directed to a remote technician that can do a visual by camera phone, you know, assessment of the chair. And in many cases, that saves a trip. And in many cases, that shortcuts repairs. There are some situations where the repair is done over the phone. And, you know, we don't even charge for that. We can't charge for that. But, you know, a lot of cases, if we can do that repair by phone, we do it. We've also implemented tech routing software where our technicians now can accomplish more stops in a day and take care of more consumers in every day. So instead of a tech doing maybe 6 stops a day, they're doing 8 stops a day. You know, you talk about us having to do in-home repairs. Yes, I know that it's well known that New Motion for a while it was mandating that certain products had to be brought into our location. And what has that happened? We've softened that mandate, but we've also found that many of the more complex consumers prefer to come to our location because they can get it fixed right away in one visit. And that's because most times we either have the parts in the shop, and if we can manage through the funding side of this, the reimbursement side, you know, where we have a payer that doesn't require prior authorization, it doesn't require medical documents for repairs, then we can fix that right there and then. And like I said, we are now up to about 20% of our repairs being done in shop because consumers are preferring to come in. I know that, Jonathan, you know, you feel strongly about the in-home, but you know, it's just from a logistics standpoint, getting to everybody's home in the time frames, we just don't have the capacity. We don't have the people. We don't have the resources otherwise. And the reimbursement structure that we're within right now doesn't support that. Some other things that we've done, we implemented a program last year called Fix Right First Trip. And what that means is we've established the top 30 parts that we use. And we stock them. We're betaing this program. We're not fully rolled out across all of our locations, but we want to stock the top 30 parts so that we can fix it the first time we go out. And not have multiple visits or lengthy time frames. Just to give some numbers, back in September, when we were just starting to come out of COVID, we had 42,000 outstanding service events across the country. We have that down because of a lot of the changes that we're implementing today. We have that down to under 32,000. I know that it's still too long. I know that it's still too much, but we get better every single day. Our call times, you know, when you call in and somebody answers the phone, answer rates are now over 90%, which they were in the 70s at one point. And a lot of these issues were driven by not only supply chain issues, but the workforce issues, us not being able to hire sufficient techs. We have 280 technicians out on, well, both in shop and out on the road every single day. We have at least 30 openings on any given day. And I know some might say, well, you just need to pay more to these techs. Well, when you're in a fixed reimbursement environment, you can't just increase your cost of doing business. You know, especially when we don't get paid for drive time. We don't get paid for anything more than actual wrench time on the chairs. So we are trying to improve every single day. And a lot of the things that I've just mentioned are just examples. And, you know, we are here in a genuine way to improve this and to get better. Now, one of the things that was said earlier was that we want to do this for more than just the Medicaid population, and I support that. Because if we could get third-party payers and Medicare to live up to these standards, that would be awesome. That would be great. That would be an environment where we could all survive. But NewMotion and Jonathan, you made light of us being a venture capital owned or private equity owned company. It doesn't matter whether you're private equity owned or individually owned. I own my own business for 35 years, and it's a difficult environment, and the economics. And I could show you that the amount of time that goes into processing one of these orders and the cost. We do not make money on service. And in fact, we lost around $18 million in service and repair last year. And that's just because of the economics of the process. And so we are genuine in that we want to get better every day. And whether we're private equity owned, individually owned, or whatever, we don't grow and sustain as a business if we don't take care of our customers. Nobody is here saying that NewMotion is perfect or that our industry is perfect in service and repair. We don't stand out and say, oh yeah, you just have to deal with it. That's not how, that's why I'm here. I'm here to negotiate and to come up with solutions that work for all. So I'm sorry I got late. I hope that helped.
Yeah, thank you, Gary. That was helpful. Wayne or somebody else from the industry, was there more that you all wanted to discuss or share your goals?
Well, I think we know that the two biggest players in the market in Connecticut are NewMotion and National Seating Mobility. So I think Diane would like to also just share the things that they're doing. What we're trying to show, guys, is that we weren't just waiting for this committee to come out. We've been actively trying to address these issues. So if Diane could just give you an update on the number of things that they're doing as well.
Sure. Thank you, Wayne. I appreciate it. And I want to make sure we address some of the direct things that Jonathan shared in his points, because part of these meetings, some of the things that we're working on internally too. So, and to just kind of not repeat what Gary already shared, because that's pretty much a standard for the industry, some of the struggles that we're dealing with during COVID and some of the challenges we're getting with staffing and getting good staff, qualified staff. We have revamped some of our training and some of the systems that we're doing internally. It's not only training for our techs out in the field, it's also how our field ops teams are working, from our customer service reps, et cetera. So there's a whole new revamp that we've gone through in the past 5 months or so, re-looking at things. And what we have done for the Connecticut market specifically is we have additional CSSs, customer service reps, that we've overhired for because of the turnover history, because of the challenges we have in that marketplace. Additional technicians we've been trying and challenged, and we've been overhiring. And part of that challenge has been, we went and looked at our marketplace in regards to reimbursement, payroll, et cetera, and did some adjustments, even though repairs are, as to Gary let out, a lost. It's usually done at negative business for us, just because of how things are set up. We are working on those. We are having pilots right now in a sister state right now that we're looking for rollouts. We do now have after hours call-ins, flex time staffing that we're piloting, actually in Massachusetts market right now that we're doing this. We also have in the California market, we have certain markets that we're rolling out, and also looking at centralized after hours for answering for repairs. Now, whether we get to the point where 24/7, I think that's quite a ways down the road, only because of cost factors and logistics and what would that look like. But we are already in that process, and it's looking to roll out after we're done with our piloting in September. We're going to look at how we're going to roll that out. What do we need as an industry for the state's various locations, and see how that's going to work. We've improved to kind of similar to what a NewMotion related to, we prioritize right now how we're looking, and when someone's, I hate to say this, trapped at home, to like some of Jonathan was sharing, we try to prioritize those when we have someone out on the road. The challenge that we're at right now for the team to understand is, when we schedule things for in-person home, when you have so many technicians routing, like Gary was saying, they get up to 6 to 8 a day. That's pretty much common for most of us in this industry to try to target. If someone has an emergency, we reroute that person. So then that person might get delayed and get pushed out because we're typically 2 to 3 weeks out because that's how much workloads we have now. There's less and less providers in the industry doing CRT, unfortunately. And so we're picking up a lot more. One thing we have improved is our remote diagnostics. We have done some new software upgrades. So we're helping some of our consumers because not everybody has a smart tablet, or depending on how they're set up, they have to do it from their laptop at home. And there were some software programs that we increased. So now, just alone in Connecticut, we've had over 750 successful remote diagnostics done to help with the initial repairs and helping determine what parts are needed, what's it going to take to get that. Another thing that was brought up too was, the training, again, going back to that, we now have a dedicated quality assurance person reviewing. So it's one thing to do remote diagnostic, and sometimes not all the remote diagnostics will ask, well, we have this on your chair. And sometimes a customer gets a new piece of part that wasn't an original that we supplied, or there's a modification. There's new queuing that we have for our team to ask certain questions, even if there's remote, to help get better equipment parts, because sometimes you might think you have the right part. We order it, we come to find out it's a modification. So there's some QA points that we're put in as part of our review process now that we're training our teams on to make sure. The one thing I want to bring up too, Jonathan, you asked about cancellations of orders and documents. Just FYI for our company, even if we go in and we create an order, those don't go away. They are on file, and they're kept on file for 7 to 10 years. So everything we put in our system, if we opened up an order and then canceled it, it's there, even a cancellation or a repeat of an order. So just FYI, we do track those. And then the other thing is we're really trying to work on what happened during COVID that kind of did not come back to life as well as it should have, is we've had a lot of stuff that we did repairs in clinics. So a lot of our customers go to clinics on a routine basis. They have monthly reviews, monthly meetings. We are now making sure we're targeting, I know in the Newington area that we're piloting some other things out right now, work with another clinic to bring in, because of those challenges of people coming into a branch or some of those other things. So these are just a couple of things that we've already put and implemented since our meetings have occurred. More to come. But I just want to kind of just add on to what Gary shared and what we're doing as an industry too, and some of the points that we're already put in place that we're looking to adopt and get rolling out in the Connecticut market. So thank you for allowing me to share some of those items.
Thanks, Diane. Wayne or others in the industry, do you have anything you want to add?
I have nothing else to add at this time.
Okay. Anybody else? Any questions, concerns, things that you want to, I see Jonathan, you have your hand up again. Do you want to go ahead?
Yeah, I just wanted to thank you, Wayne and Gary and Diane for sharing that. And Gary, I just wanted to ask, those numbers you mentioned about the 280 techs and 30 job openings, is that in Connecticut or is that nationally?
Nationally. That's nationally. Yeah.
And yeah, and I think that was it. Thank you guys so much.
Okay. There's any of the state agency folks or other people have any questions? Oh, go ahead, Senator.
You said that those are national numbers. Do you have the numbers just for Connecticut only?
I don't have them handy. I can get them for you. I'm sorry, I don't have it right now. I would say probably, if I had to guess, we probably only have 6 or 7 techs in Connecticut. We only have one location in Connecticut.
Okay, so you're saying
we have 160 locations across the country.
Right, and you're saying in Connecticut, you're 6 or possibly 6 or 7 techs short.
No, I'm sorry. That's how many we employ. We may have 1 or 2 openings.
Right, and are you fully staffed at the moment?
I think we are in Connecticut. I believe we may be, yes.
Okay. And then I have one question for Diane as well. When you were talking about the saying that everything remains documented, and that even a cancellation of a service gets documented and remains in the system.
Yes.
What is the circumstance in which there would be a cancellation of the service?
It could be a repeat. That's not uncommon. Or if there's a part. So if a person has multiple work orders open, someone may have created a work order, not realizing there's already one created in the system. It can also be if something came up where the client canceled and said, no, that's not what I needed. Anytime we open up an order, so if someone calls, we're going to open up a work order for them, no matter what. So once they called our offices or say something, we get it referral, we open up the work order for them. So sometimes it depends on what it is. So if it's 2 or 3 work orders that are open, someone may open one up as a duplication. Someone may open it up and then the person called and said, no, I can't do this. I need to cancel this. I called the wrong office. It doesn't matter. So once someone gives our name, when we create a work order, it is kept, even if it gets canceled or whatever it may be. And we can go back and look at the history of that for that client to see what they all are.
Okay, thank you for clarifying that for me.
Absolutely.
Any other questions? Oh, Jonathan, go ahead.
Yeah,
Jonathan.
I just wanted to make sure that representatives from insurance also would be able to comment on their responses to either the points or, what is the environment that they're looking at? What are their initial thoughts?
Yeah, Jonathan, everybody in the room really just got that information. So and Susan is actually away. So the insurance industry isn't going to have time to respond to that at this meeting. So Sheldon, you had your hand up?
Yeah, I'm sorry. Somebody's calling me at the same time, so I can't shut that off. I wanted to just suggest that based upon some ideas that have come up here, people have asked about data, like how many texts do you have? How many, what's the staffing like? What are the appropriate ratios? How many people are on Medicaid? How many have private insurance? Things like that. It seems like there's a lot of information to be very helpful to all of us in sort of table setting. So I just want to suggest that, and I know that among the consumer advocates, we've talked about some questions, but we just heard some now. So I just want to raise that as something we might want to do early on, get all that data in from the industry or possibly Medicaid, whatever, and then we would at least have the same sort of basis of information in deciding where to go.
Thanks, Sheldon. Yeah, I think that's a good idea, Sheldon, and maybe we're running out of time and I want to make sure we're done at 12:30. But I think the questions I hear that of data that's needed, and it's not just from the industry, I think it's from insurance. There may be some questions of the consumers themselves. I mean, we have a diversity of consumers on this call. But there may be other things we're not thinking of. So the questions I hear coming up are, DSS is on. Oh, Ginny, yeah, you have your hand up. Yes, thank you. Go ahead, Ginny.
Thank you. No, I just wanted to say that definitely the department can help with obtaining numbers on how many Medicaid members have complex rehab, wheelchairs. I didn't know if you wanted to also know how many other regular standard wheelchairs we provide as well, or just the complex.
Both. Yeah, I think, and that would be great. I would say for DSS, any and all information you have about wheelchair CRT users on Medicaid. So that would be great. I also think it would be great if we had an idea of CRT users, what percentage of them are private pay also. And I don't know if that's something that the insurance industry can work on getting for us.
I don't know how we would necessarily know statewide how many, because each plan, we can gather information from as much information as we can by plan. I'm not sure that we would necessarily be able to know statewide how many users are on private pay, but certainly I think it's also important for us to understand all plan benefits vary, right? So what the scope of the problem is from consumers in terms of concerns about coverage. And I think it was even mentioned in the start of the task force and in the list of what was included in the legislation to be looked at, kind of what's paid for and what's not across payer types. So that's something that we can do some work internally to better understand, certainly. But also, I think to the extent that there's surveys of consumers, that probably would be helpful also.
Okay. So thanks, Hillary. So hold on a second. That, yeah, actually, and Gary, why don't you go ahead? But that may be something the suppliers can help us with that. So
Yeah,
Gary.
and that's what I was hoping to do here, because I can give you a little bit of data that might be helpful here as far as New Motion. Our CRT business is roughly about 30% to 35% Medicare, another 30% of Medicaid, and then the remainder is private insurers and private pay.
And that would be pretty much the same for us at NSM. So it's pretty consistent percentages.
Great. Yeah, so that would be great. So I think anything that Gary and Diane, if you could get that information in writing to Chandra, that would be really, really helpful. So I think given the time at this point, what I'm going to recommend is that we'll have Chandra will do minutes from this. We already know some of the data that we need to collect. And what I'm going to ask is perhaps members of the task force could email Chandra other data you think that would be helpful for us to have as we move forward making decisions. I mean, I've heard a lot about, you know, how wheelchair users, whether they're private pay, Medicaid. I think maybe if the industry has some answers or can talk a little bit about, you've talked about shortage of staff and supply chain issues, you know, maybe compile some of those issues. And then consumers, if there is any data you have done from surveying others in the population, that would be great. So we can put all that together. I'll make sure it gets out to the task force people. But I think we did a good job of sort of covering a broad scope of this issue. And I think that it's clear to me from this meeting and from working with all of this group that everybody wants to address this problem, and nobody wants consumers of complex rehabilitation technology to be without the repairs that they need. How we get there is going to be the challenges, and how we address the real, you know, the real life constraints that we have in this economy. But I feel like we're all really committed to trying to get something really substantive done here. So I want to thank everybody for their time today. And the last thing I'd like to do, I think it would be really important to sort of figure out our schedule going forward. So I was going to just sort of recommend that we meet bi-weekly by Zoom. No, bi-monthly. Thank you. Bi-weekly, that would be not a good idea. So bi-monthly, and I actually came up with some dates which I wanted to propose. I know I did talk to all the committee members ahead of time, and Wayne, you said there's a big industry event going on the week of the 11th. So I was thinking our next meeting maybe could be Thursday, September 20th, and then we would do every other Thursday going forward. A Wednesday. What's today? Thursday. Okay. Oh, Okay, well, I was thinking that Thursday of that week, what, the 21st, thank you. And then we would go forward from there, every other Thursday at this time. Does that make sense to people? Does that, anybody have any huge issues with that? We understand not everybody can attend every meeting, but so it would be September 21st would be our next meeting, and then every other Thursday at 11. Yes, and we would be doing them hybrid, and it really would be great if people can try and get to the meetings in person. I think it just makes it a better experience. Jonathan, you had a,
Just same time, 11
yeah,
a.m. Okay.
I'm thinking to be consistent. Yeah, so what I kind of came up with some dates. So we would do the 21st and then every other week, but I thought in December, and some of this is going to be a work in progress. In December, we may want to meet every week because then we're going to have the, the Hanukkah and Christmas holidays are going to be like 2 solid weeks. So why don't I do this? Why don't I put out in our next communication a proposal of those dates, since I clearly can't read my calendar and have everything confused, and then we can see how that works for people. And I think this is probably a good time, 11 to 12:30. And we will make them hybrid and encourage people to get into the building. If you can, it's pretty accessible. So, so with that, I think we're done. Oh, I have 2 more questions. I'm not sure who was Diane or Sheldon, and then Diane.
Thanks. I just want to suggest, having recently been on a task force where there's a deadline and then, we're meeting bi-weekly, I think you have to be realistic that going to weekly may be necessary, and that I would suggest we sort of assess that as we go along. If it's looking like there's a lot of work to do in a relatively short period of time, we may want to go to weekly, at least consider it at that point. Thanks.
I think everybody's sort of nodding their head that we're really committed to getting this done on February 1st and having something that is ready for the next session. So I think we can do that. And a lot of us, we may have subcommittees or people doing work in between meetings as well. That oftentimes will happen. So Diane, go ahead.
Yeah, I was just going to ask if we can have, to get the information they need from us from the industry, if Chandra, we can get it to her like by end of next week to have it. And what I would ask is if we have homework or something done before for like at the first meeting, I know I'll be out of town that day, but I want to make sure I have whatever the committee needs ahead of time. So it is moving forward and working forward, and any concerns I would share obviously with Wayne and my counterparts on the committee. But just to make sure, we're very focused and succinct in what we're going to address in each meeting, because they can get derailed with a bunch. So if we can just have the agenda before, bringing it to the table, I would just ask that, just so we can keep it moving forward, to Sheldon's point. And I'm sure Jonathan's going to make the same point, that we have progressive steps in the next, and what's the clear agenda for each meeting, please.
Yeah, I agree. And as the chair, you have my commitment that will happen. And I would ask if there's information any of the groups are asked to provide, that you get it to Chandra within at least 4 days, 3 to 4 days before the committee meets, so people have the opportunity to digest the information. And we will also make sure with the agenda and that's a succinct agenda that we can get done in the period that we need to. So Jonathan, you have a question, and then we're going to wrap it up.
Yeah, thanks. I just wanted to, reiterate that if weekly is possible to begin, if not for the whole group, then perhaps if we can create subcommittees for, perhaps organize them by points that were on the consumer list. If the industry reps need to get together with the consumers to talk about a certain point, or if we need to get together with insurance reps to discuss a certain point, I think it's really important to be able to have progress every week, and discussions continuing in the background every week among members of our group, Otherwise, I'm concerned that we won't be able to get this work done before the holidays.
Okay, so
And to that point, maybe to start that off, it would really be useful, and I think it's very possible for everyone on this task force, if any of those points that I shared affect you, to just respond in writing by the end of next week. I think that's a very doable and very reasonable ask, just to get the discussion started.
hold on one second. Yeah, so a couple of things I just want to clarify. This is a statutory public task force, so we can't have sort of subcommittees per se. However, groups are certainly welcome to meet informally to discuss and do whatever work they need to do outside of the task force. Yeah, and bring the information to Chandra. So I also want to emphasize, we said bi-monthly, and I think everybody is open to meeting more often as the need may arise. So with that, if we're ending right on time, if people don't have anything else, we will see at this point. Let's just say for sure our next meeting is going to be Thursday, September 21st at 11 a.m. And that will be a hybrid meeting. Okay. Okay. With that, I guess we're adjourned of our first task force. Thank you.
Thank you.